that you all know the lens that I view our work from. Prior to joining a community health center and serving as a president and CEO here at Neighborhood Friendly Practice, I've worked in public health as an assistant health commissioner in the city of Cincinnati. Also led a public community health center that was a part of the city where we saw 45,000 patients across the city of Cincinnati, and then worked for the Department of Veterans Affairs for a long time, serving our veterans in both clinical and administrative capacities. But you know, with community health centers in our role, I wanted to talk about today both who we are and what we do as community health centers, our reach, and then also the importance of that collaborative approach, both with our academic institutions, but also with our other partners that we believe are vital to the work that we do as in healthcare professionals. So first, for those who don't know, community health centers, one of our key requirements is that we have to be in underserved areas. So that can be rural or urban, but you can't open or establish a community health center without it being in an underserved area. And there's different scores that the federal government uses to determine that, but that is a key tenet of who we are. The second one is that we provide care to everyone, regardless of their ability to pay. So again, when you talk about providing those key services and addressing health disparities, you have to see everyone, including the uninsured, those who are underinsured, and everybody in between, which is very important for the work that we do. Third, there is the fact that we provide primary care, high quality, high value primary care services. For NFP, that means primary care, midwifery, behavioral health and dental services, some substance use services, and pharmacy. And I would say those outside of midwifery, those base services are provided by the majority of community health centers across the country. And I think there's around a total of 1,400 community health centers across the country, across the US. The last tenet is that we have to have a nonprofit board that is majority patients of our organizations. So when you talk about oversight and advocacy and pushing the organization forward, developing a strategic plan, it's important for us to have a board that actually experiences our system because they are making sure that we're doing things that align with the best response to our communities, but also being good stewards of the resources that we receive. And then I want to talk about the reach. So in 2021, that was the first year that community health centers served more than 30 million Americans across the country. So when we talk about really having an impact in addressing health disparities or talking about health equity, that is a massive reach if you want to tap into that network of healthcare organizations that are really serving a large number of people. And to break that number down further, that 30 million that's 1 in every 12 Americans. That's 1 in every 5 people who are living in rural areas. And I think that's 1 in every 3 individuals navigating poverty. So again, if you think about those different subgroups, these are some of the key people who are dealing or have some of the worst outcomes when it comes to the disparities that we see across our country. And the graphic on the right, it just speaks to the type of patients that we serve. And you have a number of different languages there, but the key thing is that we welcome everyone. That is regardless of your race, your ethnicity, your religion, how you identify yourself. It doesn't matter. Again, we're open and welcome. At NFP, we serve as a refugee screener for Cuyahoga County. So we're welcoming newcomers and refugees into the city, into the county. So it really speaks to the fact that we're really opening our doors to everyone. And each health center is different, but we all have that same approach. And this is a very important topic for me here, and the fact that we provide truly patient-centered care. I think a lot of times when you have larger institutions, and I'm not saying anything about our hospital partners because we have great relationships here in Cleveland, and I've always benefited from great relationships with our universities, and especially our academic institutions. But community health centers, we know that our role is very unique in the sense that we don't provide any specialty care, we don't have an emergency department or ER, and we don't provide any inpatient services. So we have to partner with our hospital systems. to make sure that our patients have access to those services. But we also know that we can't be everything to all of our patients. So we also have great relationships with our social service organizations, our public health institutions, and our faith-based organizations, and everybody in between. And that's what I mean around patient-centered care. I think far too often when we use that term, it's very insular in the sense that we talk about our organization wrapping around our patient, but we have to look at that in a larger context, that we have all of our partners wrapping around our community and really working to address those social determinants, really working to address those key outcomes that we think that'll improve life expectancy and some of those other key measures that we look for when measuring the overall health of our communities. And then lastly, I think just wanted to touch on from the community health center's perspective, being smaller nonprofits, many of us are struggling with resources, just like I'm sure some of you on this call. But I do think it's important to share that regardless of the patients that we serve, especially some of our uninsured and our patients that are navigating poverty, they still deserve the highest quality care in high quality institutions where they go and receive their care from. So I just wanted to share a graphic of one of our sites. And there's, many health centers across the country that have a similar approach, that we want to make sure that our brand and the quality of the location that we receive care in really speaks to the value that we think of when we look at our patients. So I'll stop there. I think, hope I didn't go over my 4 minutes, but I appreciate the time, and I'm looking forward to having a larger discussion on how we can collaborate both from a research perspective, but also when we're looking to solve and address some of the issues that we know that are prevalent